Brown-Séquard syndrome is a rare neurological condition characterized by a specific pattern of neurological deficits caused by damage to one side of the spinal cord. First described by the French physician Charles-Édouard Brown-Séquard in 1850, this syndrome is often the result of trauma or other pathological processes affecting the spinal cord. Understanding the anatomical and functional basis of this syndrome, as well as its clinical presentation, diagnostic criteria, and treatment options, is crucial for medical professionals in order to provide appropriate care and improve patient outcomes. Brown-Séquard syndrome, also known as hemisection syndrome, is a neurological condition characterized by a combination of motor, sensory, and autonomic deficits on one side of the body. It occurs following damage to one half, hemisection, of the spinal cord, resulting in the interruption of ascending sensory pathways and descending motor pathways on the same side of the body. The exact location of the spinal cord damage determines the specific symptoms experienced by individuals with Brown-Séquard syndrome. The most common causes of this syndrome include trauma, such as spinal cord injury, but it can also occur due to non-traumatic causes, including tumors, infections, and vascular lesions. To understand Brown-Séquard syndrome, it is important to have a clear understanding of the neuroanatomy of the spinal cord. The spinal cord is a long, cylindrical structure that extends from the base of the skull to the first lumbar vertebra. It is divided into 31 segments, each associated with a pair of spinal nerves, and it consists of both gray and white matter. The gray matter of the spinal cord is arranged in a butterfly-shaped pattern and contains neurons responsible for processing sensory and motor information. The white matter surrounds the gray matter and consists of ascending and descending tracts that transmit sensory and motor signals between the brain and the rest of the body. The pathophysiology of Brown-Séquard syndrome involves a disruption of the sensory and motor pathways on one side of the spinal cord. This disruption can be caused by various mechanisms, including trauma-induced contusion or compression of the spinal cord, ischemic injury due to impaired blood supply, or direct damage from tumors or infections. When one half of the spinal cord is damaged, the sensory pathways carrying information from the affected side of the body are interrupted, leading to loss of sensation on the same side. Additionally, the motor pathways responsible for controlling movement on the same side of the body are also affected, resulting in weakness or paralysis. On the opposite side of the body, there may be disruption of temperature and pain sensation due to the crossing of these pathways at the level of the spinal cord. The clinical presentation of Brown-Séquard syndrome is characterized by a specific set of symptoms that reflect the disruption of sensory and motor function on one side of the body. Patients typically experience weakness or paralysis on the same side as the spinal cord injury, along with loss of proprioception, vibration sense, and discriminative touch. In contrast, the opposite side of the body may exhibit diminished or absent temperature and pain sensation, due to the interruption of these pathways at the level of the spinal cord. The severity of symptoms can vary depending on the location and extent of the spinal cord damage. To diagnose Brown-Séquard syndrome, a thorough clinical evaluation is essential, including a detailed medical history, physical examination, and appropriate diagnostic tests. Magnetic resonance imaging, MRI, of the spine is often used to visualize the spinal cord and identify the location and extent of the injury. In addition to MRI, other diagnostic modalities can be helpful in confirming the diagnosis of Brown-Séquard syndrome. Electromyography, EMG, and nerve conduction studies can assess the integrity of peripheral nerves and their connections with the spinal cord, while somatosensory evoked potentials, SEPs, evaluate the conduction of sensory pathways. Furthermore, a detailed neurological examination is crucial to identify any associated deficits or coexisting conditions. This may involve assessing muscle strength, reflexes, coordination, and sensory perception on both sides of the body. Trauma, particularly spinal cord injury, is the most common cause of Brown-Séquard syndrome. It can occur as a result of various mechanisms, including motor vehicle accidents, falls, sports injuries, or penetrating trauma. The severity of the injury and the resulting deficits depend on the location and extent of the spinal cord damage. When trauma causes Brown-Séquard syndrome, it often involves a hemisection injury, typically resulting from a contusion or compression of the spinal cord. The precise mechanism of injury may involve vertebral fractures, dislocations, or herniated discs, which can lead to direct damage or ischemic injury to the spinal cord. While trauma is the leading cause of Brown-Séquard syndrome, it can also occur due to non-traumatic causes. These include spinal cord tumors, such as intramedullary tumors or extramedullary tumors compressing the spinal cord infections, such as abscesses or meningitis, and vascular lesions, including arteriovenous malformations or spinal cord infarction. The management of Brown-Séquard syndrome arising from non-traumatic causes often requires addressing the underlying pathology through various medical or surgical interventions, in addition to supportive measures to optimize neural recovery and function. The immediate management of acute Brown-Séquard syndrome focuses on stabilizing the patient's condition and preventing further damage to the spinal cord. This typically involves immobilization of the spine using cervical collars, braces, or traction devices, as well as the administration of high-dose corticosteroids to reduce spinal cord edema and inflammation. Surgical intervention may be required in cases of spinal cord compression due to traumatic or non-traumatic causes. Decompressive laminectomy, wherein the posterior bony elements of the affected vertebra are removed to relieve pressure on the spinal cord, can help alleviate symptoms and potentially improve neurological outcomes. Once the acute phase has been addressed, rehabilitation plays a vital role in restoring function and enhancing the quality of life for individuals with Brown-Séquard syndrome. Rehabilitation approaches include physical therapy to improve strength, range of motion, and mobility, occupational therapy to assist with activities of daily living, and sensory retraining to enhance sensory perception and proprioception. In addition, assistive devices, such as braces, wheelchairs, or orthotics, may be prescribed to support individuals with deficits in motor function. Adaptive strategies and environmental modifications can also be implemented to optimize functional independence and minimize barriers to participation in daily activities. In certain cases of Brown-Séquard syndrome, surgical intervention may be considered to address specific pathologies or complications. This can include procedures such as tumor resection, abscess drainage, or vascular interventions to restore blood flow. The decision for surgery depends on the underlying cause, the extent of the spinal cord damage, and the overall health status of the patient. Surgical interventions should be approached carefully, considering the potential risks and benefits, and individualized based on the patient's specific needs and goals. Rehabilitation and long-term management plans should be coordinated with the surgical team to optimize outcomes and improve the patient's overall functional capacity. The long-term outlook for individuals with Brown-Séquard syndrome can vary depending on several factors, including the cause and level of the spinal cord injury, the extent of neurological deficits, and the availability and effectiveness of treatments and rehabilitation strategies. Some individuals may experience partial or complete recovery of sensory and motor function over time, while others may have persistent deficits. The prognosis also depends on associated injuries or complications, as well as the individual's overall health and supportive care. Advances in technology and medical research continue to contribute to our understanding of Brown-Séquard syndrome and its potential treatments. Emerging therapies, such as stem cell transplantation, gene therapy, and neural interface devices, hold promise for promoting neural regeneration and functional recovery. Collaborative efforts among researchers, clinicians, and individuals affected by Brown-Séquard syndrome are crucial for advancing knowledge, improving diagnostic and treatment approaches, and ultimately enhancing the quality of life for those living with this neurological condition. In conclusion, Brown-Séquard syndrome is a complex neurological condition characterized by a specific pattern of deficits caused by damage to one half of the spinal cord. It can result from traumatic or non-traumatic causes and presents with a combination of motor, sensory, and autonomic impairments. Accurate diagnosis and understanding the underlying pathophysiology is essential for appropriate management. The treatment approach includes acute stabilization, diagnostic evaluation, surgical interventions when indicated, and comprehensive rehabilitation to optimize functional outcomes. Continued research and advancements offer hope for future improvements in the understanding, diagnosis, and treatment of Brown-Séquard syndrome, ultimately aiming to enhance the lives of individuals affected by this rare neurological condition.